Hi, I'm Brian Finestein, CEO of St. Clare's Health. Welcome to Let's Talk Health. We're going to be joining Dr. Gregg Zimmerman, Medical Director of Robotic Surgery. We're going to be going into the OR so that Dr. Zimmerman can talk about robotics and actually how the technology actually functions. So come on, let's go. Today we're in St. Clare's operating room. I'm going to be meeting with Dr. Gregg Zimmerman, the Medical Director of our robotics program, to learn more about this technology. So, hi Dr. Zimmerman.
Hi Brian.
So it's called robotic surgery. Is it really about a robot?
Actually, no. If it was a robot, what we would do is we would program a robot, the surgeon would stand in the corner drinking coffee, and the robot would do the surgery. This is really computer-assisted surgery. It doesn't do anything unless the surgeon is doing it at the same time. So it's really a mimic of what the surgeon is doing. At St. Clare's, we use the Vinci Exci robot. It's called the Da Vinci because Leonardo da Vinci was credited with creating the first robot in the world. We use the Exci because that's the most cutting-edge, newest technology, and that's what we use at St. Clare's.
So tell me, and tell our viewers, how were you introduced to the robot?
Well, after I finished my urology residency in the University of Florida, I did a fellowship in urologic oncology. And at that program, we converted all the open cases to robotic cases. I remember my first day there. I actually was an observer that day. We came in and we had 2 robotic prostatectomies to do. Now, using the open technique, the robotic prostatectomies take maybe 2.5 hours, maybe 3 hours. Well, because this was very early in the learning curve, this took 7 hours and 8 hours. I remember going home that night. I said, did I make a mistake? Was this the right thing to do? Is this really going to catch on? So I came in the next day, and I remember we had conference. And after the conference, it was about 10:30, I came to the room where both patients were. And they were both standing in the doorway saying, what took you so long? We're ready to go home. And that's with 7 and 8 hours. Imagine now when it really takes 2 hours to do. So that made me a believer.
Did it though? I mean, again, you had that long length of time. So really and truly, what did make you a believer? Because you're hoping that it's going to come down to 2 hours.
Right. Well, with practice, more and more cases, it has. And it's even shorter than I could do it open now. But even when it was 7 and 8 hours, the patient still had less hospital stay and better outcomes.
Okay, thank you. So, Dr. Zimmerman, you launched this program here in, I believe, 2007. What was your vision for using this for urologic surgeries?
Well, in 2007, that was very early in the adoption and implementation of robotics. At that time, we had open surgery, which was the classic surgery, very invasive, but you had a ton of control in the operating room. And then you had laparoscopic surgery, which was minimally invasive, but you didn't have the same element of control that you had with the open procedure. So there was a real gap there. With robotics and the advanced instrumentation with elbows and wrists, that was able to span the gap. So now you had the minimally invasive nature of laparoscopic surgery with the control that you have with the open procedure.
Now, the surgery itself has evolved into the other specialties. Can you tell us something about those?
So when we started here at St. Clare's in 2007, we had 4 urologists that did robotic surgery. But quickly, the gynecologists got on board, the urogynecologists, gynecological oncology. Now, general surgery is the biggest area of growth. They're doing cases like gallbladders, hernias, intestinal surgery. Robotics can be used in bariatric surgery and even thoracic surgery. So it's always expanding.
Now, what do you see as the next threshold? Have you given that some thought?
Well, the instrumentation continues to improve. Right now, there's still rigid instruments with elbows and wrists. Maybe at some point they won't be. It'll be more like snakes where they can weave in and out. It's always evolving.
So what are the benefits to the patients for robotic surgery?
So the minimally invasive nature of robotic surgery allows for smaller incisions, less blood loss, which equates to almost no transfusions, less pain, so less use of narcotic pain medications, shorter hospital stays. Patients get back to their lives quicker. They get back to work, they get back to school if they need to. So those are the main advantages.
Now, how about for you, the surgeon? What are the benefits for you?
There actually are advantages. When you think about classic surgery, you're standing at an operating table for sometimes hours on end. In robotics, you're sitting in a comfortable chair. The robot is actually tailored to your size and shape. So you're sitting with very good posture. And what that equates to less musculoskeletal problems like back pain, hip pain. And that will increase the longevity of someone's career and allow you to help patients for a longer period of time.
I'd like to take a closer look at this Exci Da Vinci robot. Perhaps you can show us how it works.
Okay, let's do it. So Brian, there's 3 parts to the robot. There's the surgeon's console, there's the visual cart, and there's the working element. This is the working element. There's 4 arms to the robot. What's interesting is the camera can go on any of the arms, and you can change it during a surgery. So if you need to do multi-quadrant surgery, you can put it in any of the arms at any time. So this is called a trocar. This is what actually goes into the patient. You can see how small it is. This is the size of the incision that you make. So when you put the trocars in the patient, these instruments, which have elbows and wrists on them, actually go right through the trocar like this. The robot recognizes it, and when you hear that sound, it's ready to go. Brian, you want to go take a look at the surgeon's console?
That'd be great. Greg, we just received 2 questions from our viewers. The first, the patient comes in and the decision made that they need surgery. How do we decide whether it should be done robotically or not?
Well, that happens frequently. Patients will come in asking, can this be done robotically? And it really depends what type of surgery that they need. If it's superficial and not deep in the body, it's probably not a candidate for robotic surgery. But the indications and the types of surgeries are always expanding that we're using robotics. So it's really a surgeon's decision on whether or not robotics is appropriate.
Now, can all surgeons do these procedures robotically?
Not yet. More and more surgeons are being trained, but it does require specialty training. As people are coming out of residency, more people are learning while they're in their training though. Brian, let me show you the surgeon's console.
Okay.
Okay, Brian, we're here at the surgeon's console. This is where the surgeon actually does the operation. So the first thing is, this is where the surgeon's head goes. The vision is magnified. It's 3-dimensional. It's high definition. So it's like actually having your head inside the patient. As far as movement of the instruments, everything is done with these fingers. So you put your fingers in these rings like this, and whatever you do, the robot does in real time with you. Depending on what instrument you're using, you might cauterize, you might cut, you might retract, but they can be changed throughout the case. Your feet do things too. You can cauterize, you can toggle between instruments, you can move the camera in and out. It's almost like playing the drums.
Very cool. Thank you, Dr. Zimmerman, and thank you, viewers, for watching this important segment of Let's Talk Health. For these and future events, please go to www.stclares.com, or you can also catch this segment at St. Clare's on YouTube.